caller.
Welcome, everyone. Thanks for joining us this afternoon for the special Board of Health meeting to consider an indoor mask mandate in Adams and Arapahoe counties. I'd like to call this meeting to order. It's 4:30. Renee, could you do the roll call, please? Renee, you're muted.
Thank you. Please state present after your name is called. Representing Adams County on the Board of Health, Julie Mollica.
Present.
Rosanna Reyes.
Present.
Julie Schulz.
Present.
Representing Arapahoe County on the Board of Health, Jan Brainerd. Dr. Thomas Faywell.
Present.
Dr. Kaya Gallagher.
Present.
Tri-County Health Department Leadership, Michelle Askenazi, Director of Emergency Preparedness, Response, and Communicable Disease Surveillance.
Present.
Heather Baumgartner, Director of Community Health Promotion. And I believe Heather is not present today. I believe Mara Proser's in representing Heather.
Yes, this is Mara. I'm present as Heather's representative.
Perfect. Thank you, Mara. Lisa Bolstad, Administrative Assistant.
Present.
Jill Bonchinsky, Director of Nutrition.
Present.
And I'm Renee Brockman, Executive Assistant. Monique Didier, Director of Administration and Finance. Dr. John Douglas, Executive Director.
Present.
Furman, Director of Human Resources.
Present.
Penny Grandy, Director of Nursing. Penny Grandy. Jennifer Ledwig, Deputy Director.
Present.
Dr. Kelly Weidenbach, Director of Planning and Information Management.
Present.
Roll call is now complete.
Renee, I see that Randy Demmett, the attorney for Tri-County Health, is also with us. Are there any other guests that need to be introduced? Michelle?
Yes, we have Joshua Vine, our safety and security specialist, on here.
Okay. Any other guests? Seeing none. We have 3 items on our agenda tonight. First, we will get a COVID update and rationale for the mask order from Dr. Douglas. That will be followed by a 30-minute public comment period. And then the board will move into action items where we will discuss and vote on whether there should be an indoor mask mandate in Adams and Arapahoe County. The members of the public who have signed up for the 30-minute comment period will have 2 minutes to speak. Then Any of the board members of the public who wish to provide additional feedback are welcome to use the Q&A function to write comments during our meeting. Please also recognize that there is a substantial amount of information on the Tri-County website that offers answers to frequently asked questions, as well as fact sheets related to the COVID pandemic as it affects businesses and schools. There are also options for contacting members of the Tri-County team. If the Board of Health chooses to approve a proposed indoor mask mandate tonight, additional information regarding this order will be posted on the Tri-County website. Since we have allocated time after the public comment for board discussion, I would ask my fellow board members, as after we listen to Dr. Douglas's presentation, to ask clarifying questions, but save your more substantive comments and questions for the action item period, which follows the public comment. That said, Dr. Douglas, please.
Thank you, Kaya. Lisa, can you pull the slides up, please? Again, thanks to the board members for your interest. Appreciate those who've been asking clarifying questions. I hope we can have more of that today. So what I'll be providing again today is both an update on COVID, very highly focused on the issues that might pertain to masking, as well as a rationale for the mask order. Next slide, please, Lisa. I'll be covering data that's relevant to the whole reason we're having this conversation, which is the crisis in hospital capacity, modeling updates from our School of Public Health colleagues, a rationale for a mask mandate, as well as our recommendation to the board. Next slide, please. So every time we give a COVID update, I show you guys what's happening with incidence rates, and incidence rates in the 3 Tri-County counties. On the left side have been progressively going up. As you can see, we are at a point where number of cases per 100,000 on a 7-day rolling average, these are daily numbers, by the way, is about what it was in last December on the downward slope. So we are not, from a case perspective, in as bad a place, but we are getting closer. The right graph shows you what's happening in the state, and honestly, the story is about the same. You can see that the state's rates get us up to about where we were on the downward slope in late December. Now, these are cases. Next slide, please. These are hospitalizations, which is really what's driving the conversation right now. I've reversed these. On the left is the state. I will remind you that hospitalizations do lag in reporting, and whenever we see a downward slope like we see on the left of that state curve, which was taken from Friday, be aware that it could be real, that would be great, or it could be a lag. The right shows Tri-County county rates. These are on the left, the state are actually new hospital numbers. So it's a different metric, it's a different y-axis, although the shape of the curves, as you can tell, looks somewhat the same. We've shown ours in rates per 100,000 over a 14-day rolling rate. And as you can see, Arapahoe and Douglas County have come up and plateaued. Adams County is having a more challenging time with numbers getting up, honestly, to where they were in the middle of December last year. Again, you see that little downward trend that could be real. It's probably not. It's probably a lag in reporting. Next slide, please, Lisa. This is a slightly different way of looking at hospitalizations at the state level. This is looking at the number that are currently in the hospital. So on Friday, counting both persons with confirmed COVID as well as those that are, quote, under investigation, meaning their test is pending, likely COVID, but not yet proven, there were 1,574 persons in Colorado hospitals. That was the most since the middle of December 2020. Next slide, please. This is a reminder that we continue, this is data from the School of Public Health modeling team, to see a very strong correlation between vaccination rates and hospitalization rates. And notice, of course, that our counties tend to be on the rightward down part of that. Adams is a little above the line. Arapahoe and Douglas are a little below the line. We're not as close to the bottom part as Boulder and Broomfield, but we're closer there than some of our colleagues in less well-vaccinated counties such as Mesa, Pueblo, and Weldar. Next slide, please. This is looking at this phenomenon that we continue to hear about, the pandemic of the unvaccinated. The right graph, I've shown you guys this graph before. This is updated on a daily basis. Colorado on Friday, 82% of people in the hospital are unvaccinated. 18% are vaccinated, representing breakthrough infections. Our graphs, which we show on our website, are a little harder to see than that nice Colorado graphic, but we're seeing pretty much the same thing. I would point out to you, it's the dark part of the histogram in each month. If you go back to June and look at the proportion of those histograms that are dark, and then look at July, and then August, and then September and October, the proportion of all hospitalizations that are due to breakthroughs is increasing. That's as a result of two things. As we get more vaccinated people, a bigger part of the at-risk people are those that are vaccinated. And even with very good vaccines, one can have breakthroughs. But it honestly probably also represents the need for booster vaccines. So we've got folks that were, our peak of vaccination was in March and early April. We are really getting to the 6-month point where immunity is beginning to wear a little thin. Next slide, please. And that, sorry, I didn't get that cleaned up. This is an updated slide, but we've already talked about it. So next slide, please, Lisa. This is showing you how Colorado counties vary by first rates of hospitalizations. So this is 7-day new admissions per 100,000. And the point here is that the more highly vaccinated counties have the lowest rate. So Broomfield's got the lowest in the state. If you sort of scroll up, you'll see Arapahoe and Adams in the bottom 40% or so. So on the one hand, we're doing not so bad, actually pretty well in terms of our risk per capita population of hospitalizations. That's really, again, as that previous slide showed, due to heavy, high rates of vaccination. Next slide, please. But if you look at the absolute number of hospitalizations, then the curve flips. And this is purely a population phenomenon. So now the county that's got the most in the state, this was data the state health department compiled last week, is El Paso. Arapahoe is number 2, Denver 3, Adams is 5, Douglas is 7 in there. So even though our rates are lower, the absolute number of people we have getting hospitalized with COVID tend to be near the top part of the state. And this is relevant for the question of whether or not does doing anything in a specific area of the state matter if the whole state doesn't act. And while, as we've discussed with the board before, we do think that statewide action is in general, and certainly for a mask mandate, we think this is the case, preferable to regional action. We still think we have an absolutely large enough number. It's about 40% of total hospitalizations last week, that even metro-based action could have a substantial impact on the hospital crunch. Next slide, please. And this is the crunch, probably the key slide for the crunch. And this is looking, these are data from Dr. Hurley, our state epidemiologist, looking at what's happened to hospital capacity. And what I want you to do is to look back at that terrible time we had last December, when you had that Mount Everest of high levels of hospitalizations. That's the blue bars on the bottom. And the gold bars on the top are total beds available. So during that very bad time, we had about 1,800 or so folks in the hospital, actually a little more than that. And we had an almost exactly similar number of beds that were still available or that were available for COVID and all other conditions. Fast forward to November of 2021, and that total staffed bed capacity number of 3,600 has dropped by 39%. We're down to about 2,185 at this point in time. And as we discussed at the last Board of Health meeting, the capacity problem is not because we don't have ventilators. It's not because we don't have physical beds in the hospital or IV pumps or sheets on the beds. It's because we don't have staff. So the staffing problem has really enormously exacerbated our staffing crisis. And while an easy answer might be to say, let's just go hire some more staff, the answer is there are no staff to be found. We've been asking FEMA to come in and staff hospitals because we simply are having trouble hiring the same kind of people that we did. The Great Resignation, this phenomenon where lots of people are seeking new employment or sort of taking a life sabbatical, has been particularly strongly felt in the healthcare field, and probably strongest in those that have been on the front lines in the hospitals. Next slide, please. This was Friday's look at hospital capacity. On the upper left side, the brown stuff is hospital region. We're in the Mile High region. As of Friday, 7% of ICU beds were still available. Looking at the state in the upper right-hand corner, this is pulling everything together. 95% of ICU beds were full as of Friday. So we had 5% that were vacant. And looking across our own counties, this is Friday data, looking at Adams and Arapahoe in particular, the percent of our ICU beds that were full on Friday, 92% in Adams, 8% free, 99.4% in Arapahoe, 0.6% free. Now, we like to think about things regionally because no county, and the hospitals in no county is an island. The hospitals work very effectively across the state. Frankly, one reason we worry about the need to do things at a state level is that the hospitals exist in a statewide ecosystem. But just to let you know what it looks like in our own particular counties, even Douglas County, 96% full. Next slide, please. This is another way of looking at ICU bed availability in our region. The North Central region is a region defined by emergency preparedness coordinated activity. It includes the 7 metro counties, including Douglas. It also includes Gilpin, Clear Creek, and Elbert. So it's a 10-county region. And what you can see, the dates are hard to read, I'm sorry, but it goes back to the middle of August when you can see we were kind of hovering around maybe 20% of ICU beds being available. And then in mid to late September, we dropped down to about that 10% level, which is the pink zone. And then we began to drop even further. And over the last 2 weeks or so, we've been largely below 10%. In some cases, some days as low as 5%. Next slide, please. Now, those are the data. And, you know, public health messaging 101 is tell me the data, but tell me the stories. And I'm not going to give you a roster of stories, but our local media have been full of these stories. So this is a couple from CBS 4 Denver last week, a family, and I think this is in Jeffco. They tried to take a loved one to Lutheran Medical Center, not for COVID. They had some sort of neurologic problem, a brain aneurysm, had surgery, tried to go back, ER was on divert, couldn't get a place to go, had to drive around trying to find another hospital. That's a story from the perspective of a patient. The upper right corner is the heartbroken doctor's concern story. This is from Northeast Colorado, referring to what is going on there. Dr. Breyer, chief pulmonologist at UC Health, Northern Colorado. Dr. Breyer is more worried than at any point in the pandemic about staffing. ICUs in Weld and Larimer are operating at or beyond capacity for months. Rooms doubled, beds filled with patients battling COVID. At the same time, staffing in UC ICUs is stretched as many nurses have either chosen to retire or changed professions as a result of the pandemic. Scroll to the bottom right, news report out of, this is the San Jose Mercury News newspaper, a strike in the Bay Area of Kaiser workers. This isn't Colorado, but it's part of the same story. COVID-19 pandemic exacerbating an existing shortage in nursing. And then scroll to the lower left, a discussion yesterday's Denver Post headlines about crisis standards of medical care. This particular article was, should we be triaging people based on whether they've been vaccinated or not? Very controversial topic. Most ethicists would not agree with this, but just to alert you to the fact that this is a conversation that's happening real time right now. Next slide, please. So I next want to talk about the Colorado School of Public Health Modeling Report. And all the slides I'm going to show you next are not my words. They're the words from the school. And I just wanted to transparently let you know their thoughts and how they put it together. And their big sort of executive summary, if you will, key messages up front. They estimate a 48% chance that hospital demand exceeds 2,000. 2,000, by the way, is the number by which we will exceed hospital capacity in the next 7 weeks if we retain our current trajectory. And this assumes a modest increase in context over Thanksgiving and late December holidays. Booster uptake's increasing, but we're still not on track to meet targets that would avoid hospital capacity being crunched. That's 70% of eligibles boosted by the end of the year. And although high booster and pediatric vaccine uptake will help us a lot, both in hospitalizations and death, most of that benefit doesn't start to kick in until late January, February, or the spring. So it's really important, probably the most important thing, but it's not going to be as immediately impactful as we'd like. Therefore, even if Colorado hits its vaccine goals, reasonable probability, 48% last week, that will exceed capacity in 2021 without additional interventions to reduce transmission or reduce the disease severity. Reducing disease severity is treatment. Monoclonal antibody treatments can have great impact on hospital demand if we can scale them up. But the most effective methodology is probably going to be to reduce transmission. And unless we go into a modified dial-like lockdown, which nobody wants to do, masks appear to have the greatest chance. The conclusion of the school was masks have unequivocally been shown to reduce transmission. However, in full disclosure, we don't really have a tremendous amount of data that at least the school was able to analyze about statewide mandates. As Dr. Samet, the dean and the head of the modeling team, put it to me in an email this weekend, we really have insufficient evidence. We don't have negative evidence. This is such a changing topic that the evidence we have, in his judgment, isn't fresh enough to draw definitive conclusions. Next slide, please. This is looking at the trajectory question. And again, on the current trajectory on the left-hand graph, 48% chance we exceed hospital capacity before the end of the year over the next now 6 weeks. If the holidays don't increase transmission, if the airports don't get the sort of record number of travelers that they're expected to get, we do better, but we still have a 4 in 10 chance that by the end of the year, 41%, that we would increase hospital or exceed rather hospital capacity. Next slide, please. And they concluded by saying, look, we've got really 3 main ways of avoiding crashing or exceeding hospital capacity. We can build population immunity through boosters and vaccines. That'll pay off particularly in 22, spring waves, hospitalizations, and death, not so much so in 21. We can reduce disease severity through treatment. Treatment right now is monoclonal antibody given by IV infusion or sub-Q injection, or we can slow the spread of infection through transmission control. The latter 2 are really the key to avoiding the exceeding hospital capacity in 21. Next slide, please. And this is putting sort of those 4 ideas together. So current trajectory, 48% chance we exceed it, upper left corner. We do as good as we sort of like aspire to, if you will, high booster and pediatric vaccine uptake. Then we reduce that possibility. This is increasing uptake, for example, boosters, 75% by the end of the year. Then we increase it, or rather decrease it by 2%, down to 46%. If we increase transmission control by 3%, which would include a substantial increase in mask wearing, then we reduce things down to 30%. It doesn't go away, but it reduces it by more than the vaccines do. And if we can increase monoclonal antibody treatment to 50% of eligibles, then we could get the lowest of all, down to 25%. Next slide, please. This is just giving you a sense about what those individual projections for pediatric and booster uptake looks like. And basically the bottom line is we're currently estimating that by the end of the year, we're going to get to 34%. So this is as of last week, we were at 34%. And the trajectory is not yet at this point that we get anywhere close to that. The trajectory is that we might get to somewhere in the mid 60s. And again, to really hit that target that we would need to reduce the chance of exceeding hospital capacity, we need to get substantially higher than that. Next slide, please. And this is the pediatric vaccine parallel document. Based on recent trends, we think probably we'll get to 41% of 5 to 11-year-olds by the end of January. In the increased scenario, we might get to 70%. That's substantially faster than we did with 16 to 19-year-olds last spring. And while it's possible that we'll get there, we're nowhere near on course at this point in Colorado to achieve that rate. I'd love to see that go up, but we're not going that fast yet. Next slide, please. This is maybe the most important slide in terms of what else could happen to really make a difference. It's looking at the monoclonal antibody therapy question. And so we estimate that if we get up to, let's go to the lower left corner, the high uptake estimate. We're currently batting about 15% of eligible people. If we could get up to 30% of eligible and it really worked the best, 80% hospitalization reduction, we'd see a 14% reduction. That's the upper right quadrant there. If it works, if we get even more eligibles vaccinated up to 50%, this is what the governor's been aspiring towards. I think it's a really important aspiration. We might get up to 23%. It's really important to note that the number, that this one of the major caveats of this, and it's a caveat we encountered last week when we had a discussion with the state about whether Tri-County should start becoming a sub-Q monoclonal antibody injector. And the answer was, we don't really have sufficient supply right now that we can guarantee for you to go to the effort of becoming a sub-Q injector site. And this is the vicious circle we're in. Lots of sites are considering it, but they're asking, well, listen, if we go to all these trouble to set up the protocols, is there going to be med there? If we advertise that we're ready, is there going to be med there? And the answer is not necessarily. Next slide, please. So let me flip to the last category, the transmission control prevention. And I'll begin. Again, these are the words of the state health, the School of Public Health, not my words. The statewide mask orders now, not a year ago, but now affect transmission. And the school concluded, we know masks reduce transmission by protecting others and the wearer, that mask mandates in schools, even in September, documented by CDC in a nationwide study, reduced transmission. And over the course of the pandemic, statewide mask mandates have reduced transmission. So the question is, do they currently do that now that masks have become ever more controversial? They did major looks at other states, comparing how states with mask mandates were doing. And because one of the states that's got a mask mandate is a neighbor to ours in the South, the governor asked the school to focus in particular on New Mexico. Next slide, please. And what they found when they graphed out adjusting for the level of vaccination, whether or not states such as Colorado, New Mexico, or the other three Western states, Nevada, Oregon, and Washington, had reduced rates of infection over what would have been expected, the answer was New Mexico did not. And you've probably heard reference to the fact that probably mask mandates don't work because New Mexico doesn't have rates adjusted for the level of vaccination any lower than Colorado does. It's probably not worth trying. What was not really included in the school's analysis is what's happening in the other three states. Oregon, Washington, and Oregon are all below that regression line of what you would expect. Not a lot, but enough to potentially get us to that 3% transmission control improvement scenario. I would mention that as of this morning, daily rates in Colorado are currently number 10 in the country, and we have a rate of 57 per 100,000 per day. That compares to 63 in New Mexico. So New Mexico is actually a little higher than us, but it compares to 22 in Washington, 20 in Oregon, and 22 in Nevada. In other words, those other three states, the state regressed this last week, have actually got rates currently less than half of what we see in Colorado. Next slide, please. And again, these were summary points that they made. A lot of these repeat the original ones. Current trajectory, high chance, 48% right now, we exceed capacity. Interventions to reduce severity, treatment, or reduce the spread is really what we need in 21. It's unclear if we can hit the aggressive monoclonal antibody targets. The vaccines are important. They won't kick until 22. So really to reduce the probability of exceeding hospital capacity, which has been really since the beginning of pandemic, what the state has declared to be our North Star. Why are we putting our residents through these painful, uncomfortable, controversial measures? It's to avoid exceeding hospital capacity and rationing care, and short-term measures to reduce transmission unless the monoclonal antibodies can be sufficiently scaled up are the name of the game. Next slide, please. I didn't really understand this till about a month ago, but the Carnegie Mellon Delphi modeling team, it's a group of mathematical modelers, has been taking Facebook data and has been mapping. If you go to this website, they will come up with projections on a daily basis of what's happening with mask wearing based on surveys conducted on Facebook in all, not all, but most of the 3,300 counties in the US. Broomfield's not included, for example, but other large counties in Colorado are. So take a look at what happened in Boulder when they initiated their mask order in the beginning of September. They went up from about the high 50s up to, over the next month or so, up to the 80s. Larimer initiated an order at an even more concerning point in time, October 20th. They went from the high 50s up to the low 80s over about a 2-week period of time. Please note that in contrast to that, Adams, Arapahoe, and other metro counties really did not make any sort of substantial increase at all. It was only the 2 counties that introduced the mask mandate. And I show you this because while state comparisons I think are really useful, if we're thinking about what to do in our counties, looking at what's happened in other counties, I think may be more relevant. Next slide, please. This is a fresher look at that data, and it gives you a current, that slide was put together about 10 days ago. Current average upper left corner, Larimer County, 81%, lower left corner, Adams County, 50%, upper right corner, Arapahoe County, 54%, Jeffco, just because they're a neighbor who, even as we speak, are having a similar discussion with their Board of Health, 53%. Next slide, please. What I think is most striking is what Larimer County observed in terms of hospitalizations, hospital admissions. They're using 7-day hospital admissions per 100,000. And particularly because they're proximal to Weld and had a pretty similar trajectory, they compared what was happening there in Larimer County, shown in green, to Weld County, shown in red. So Larimer initiates their order on the 30th of October. And about 10 to 14 days later, they begin to see a decline. Actually, it was about 10 days later. At the same time, Weld is not a perfect comparison, obviously, but Weld, who initially had a decline, then began to see an increase. Larimer's increase, or rather decline, has recently plateaued off. So it may be that a duration of mask wearing has a certain saturation effect. But I would submit to you that the increase in mask wearing data that they saw and the associated decrease in hospitalizations is probably one of the most relevant examples for us to consider as we're trying to avoid the hospital capacity cliff. Next slide, please. So in summary, we've been having discussions in the metro area with other public health directors. We have been having frequent requests to the state health department about their taking either statewide or up and down the front range type action to institute a mandate. We do believe that the more broad a mandate is used, the more normalized it is, and it frankly deals with the fact that we're in an interconnected hospital system. Our view was that hospitals are very close now to a crisis point. The need to ration care is increasingly possible over the next several weeks. Avoiding this outcome is going to take action in the areas we've talked about: vaccination, ideally increasing hospital bed capacity if we can find some staffing, increasing treatment and slowing the spread of infection through increased masking. None alone is likely to be sufficiently effective. While statewide action to increase masking, and statewide actions occurring now for everything else, hospital capacity, vaccination efforts, monoclonal antibody upgrades, would likely be the most effective. Based on many discussions over the past several weeks, it's very unlikely CDPH is going to take this step. In fact, we had our last conversation with CDPH on Thursday afternoon, and it was at that point that we somewhat urgently realized that what we thought would be best and probably most effective wasn't going to happen. We felt that if the state was unwilling to act, metro-wide action to implement mandates could provide benefit given the size of our hospitalization, rather population and number of hospitalizations, even though our rates tend to be on the lower side. And we also felt it was likely that while we know there will be controversy associated with this, we're not being naive about it, but we also believe that a public health order would communicate a seriousness about the importance of masking, that prior efforts, such as recommendations that we made at the end of July saying, hey, the CDC says masking in public indoor spaces ought to be done in any area with substantial or high transmission, no change. We put out a public health advisory in a few weeks ago. That's November of 21, not November 21st. No change at all in uptake and masking. We thought that such a mandate really needed to be initiated as soon as possible, given the likely increased transmission occurring over the Thanksgiving holiday season and continued until hospital capacity crisis had passed. Currently, Jefferson and Denver are considering implementing mask mandates. Broomfield discussed it over the weekend, has put it on pause for at least the next few days. Combined with Boulder already, as well as our two counties, we think this could create this sort of uniform approach across most of the metro area that our municipal elected officials have continually asked for, and our businesses have continued to indicate that they prefer. Next slide, please. So our proposed mask mandate for Adams and Arapahoe counties would, in general, we propose to begin on this Wednesday, midnight on Wednesday, remaining in effect until at least, it says January 3rd here, would be through January 2nd, through the New Year's weekend. And thereafter until staffed ICU bed capacity in the North Central Emergency Preparedness Region reaches 10% or greater for 14 consecutive days. This is not a forever policy. This is a policy that's directly tied to the crisis we're facing right now. We have been at or above 10% as recently as a month ago. This is not an impossible situation, but it's a really critical. The order will be enforced on a complaint basis and through an education first approach. This is how all of our public health orders have been enforced. Next slide, please. In a little more detail, this would involve individuals ages of 2 and above being required to wear a face covering in all public indoor spaces. Exempt would be those under 2 or who cannot medically tolerate a face covering. In addition, there are a number of other exceptions where face coverings can be temporarily removed, communicating with someone who's hearing impaired or otherwise disabled, or where the ability to see the mouth is essential to communication. When you are seated at a food service establishment or actively eating or drinking, what that functionally means in a restaurant is you walk in with a mask on, you take your mask off to eat and drink, you put your mask on when you get up to go to the restroom, you take it off when you eat your dessert, and you put it back on when you leave the facility. It's also exempt during receipt of a personal religious or medical service where the temporary removal of the face covering is needed to perform the service. If you're a Christian, communion requires, although actually I have been taking communion under my mask, you can take your mask off for that. You can temporarily remove it for identification purposes. We've all probably had the experience of having to do that at the airport if you've bothered to travel by airplane. If you're engaging in a public safety role, such as law enforcement, firefighting, or emergency medical personnel, giving a speech for a broadcast or an audience as long as 12 feet are maintained from non-household members. If you're engaged in a performing arts performance, again with a 12-foot distance. If you're engaging in swimming, where your mask would become wet and unusable, or if you're engaged in settings such as gymnastics, tumbling, cheer, or wrestling, where it's not safe to wear a face covering. Next slide, please. We are also including in this a voluntary program that Boulder has been using for the last 2 months, in which about 5% of their businesses have chose to engage. They call this a voluntary vaccine verification program. Facilities that wish to enhance their safety, no coercion, can voluntarily choose to enlist in it. The program requirements are that you must have a written policy submitted to Tri-County and communicated to employees and customers, program signage on entrance, tracking individuals entering the facility. And the core of it is you need a policy that requires proof of vaccination, a system for evaluating exemption requests, if you're going to choose to allow exemptions, resulting in 95+% of the individuals in the facility being vaccinated, with 5% being able to be exempt or not eligible. We will be requiring approval from Tri-County prior to operating the program, although we're likely to have a brief phase in. We haven't quite decided on the duration of the wording over the time period from Wednesday to the next week to give facilities that want to self-describe to us their approach without having to actually have a policy, because we realize that our staff ability to review the policies during Thanksgiving will be somewhat limited. Eligible facilities and events include one-time events, gyms or other classes that can be held at certain times a day if you don't want the entire facility to be under this program, a single building or single organization operating across multiple buildings, and this includes bars, restaurants, and offices. And again, the whole rationale for this is not to be punitive. It's basically to incentivize voluntary adoption of vaccine requirements in public spaces with high degree of vaccinations in which transmission risk can be substantially lowered. All of the other metro departments that are considering this mask mandate are also considering this program. We do not expect most businesses, very similar to the 5-star program that took place during the days of the dial, to choose to use this. But we do think it will be a good fit for those who already are practicing some of this and want to be rewarded by being exempted from the masking requirement with their written policy. Next slide, please. I'm going to stop here. The proposed motion that I will ask the board to discuss includes an authorization and direction of me in response to the pandemic and to address the growing crisis in the hospital capacity to issue a public health order requiring individuals 2 and older, with limited exceptions, to wear face covering in all public indoor spaces in our 2 counties, effective on Wednesday the 4th at 12:01 a.m., remaining in effect through Sunday after New Year's, and thereafter until staffed ICU bed capacity reaches 10% or greater for 14 consecutive days, and allowing owners, operators, managers of public indoor spaces who've implemented vaccination requirements for all individuals entering their space, 95% plus, in accordance with guidance that we'll be providing, to request an exception to mask wearing requirements for individuals within their public indoor space. Thank you very much, Kaya, and I'd be happy to take information clarifying questions.
Thank you, Dr. Douglas. Does anybody have some questions for Dr. Douglas before we move into public comment, recognizing that we'll be able to ask questions and have discussion after the public comment period? Okay, I'm not seeing anyone, no hands raised. So we'll now move into our 30-minute public comment period. Members of the public, Jan, I'm sorry, and Dr. Faywell, I'm seeing hands raised now. Jan, did you have a question?
I did. Sorry, I was a little late on that. Just
okay.
Qualifying, I'm not sure if when we were going through the last part, the last 2 slides, what is considered for that particular place to be able to put in their request for an exception? Do they have to be fully vaccinated? And now I'm hearing they're coming close to saying fully vaccinated may mean a booster. So I was just wondering where that might fall.
Yeah, Lisa, can you pull that one back up just so while we're talking about it? Let me clarify the booster question at this point, Jan. It's a really good one. Right now, fully vaccinated is considered to be 1 J&J or 2 RNA vaccines. We are clearly realizing that boosters are going to be an important part of the equation, but that's not being included at this point in time. Slide before that, Lisa. Yeah. So again, Jan, program requirements is a written policy, signage. The policy has to show the ability to track folks, including proof of vaccination, evaluating exemption requests, resulting in 95% of folks in the facility being vaccinated. As of next week. I'm sorry.
No, I'm sorry. I just wasn't quite sure what was going to be defined as required proof of vaccination, if it still is exactly what you said, or if there was any thought to that might be changing if if the CDC changes what they consider. I assume we would change that.
If this program were to go on for a long time, that is, I think, quite a reasonable question. At this point, we are considering the current quote fully vaccinated as just defined.
Okay, thank you.
Dr. Faywell?
Can we go back to slide 3, the incident rate? In 2020, Colorado had a mask mandate from July of 2020 until May of 2021. Yet our incidence rate went straight up, just as it's doing now. One doesn't need modeling to predict at this time of year, viral respiratory infections are going to go up. When we go to slide 4 and 5 about the hospital admissions, it shows the same trends. Again, you don't need modeling for that. We can predict in colder climates in the northern states that's going to happen year in, year out, whether it's influenza or something else. Now, we stopped influenza last year. That was good, but nobody went out. Nobody was getting together. The slide that you showed, number 6 on correlation of vaccinations to hospitalization, I think is the strongest argument for where our efforts should be directed. Bed capacity is at all-time low, yes, and there are many factors to that, not just our incidence rate. There's the fact that many procedures were put off from last year. And you say, well, if it's an elective procedure, you can elect to do it next year. Well, sometimes those procedures that are put off result in things that are going to become all of a sudden an emergent issue and not something that you can put off. And therefore, more people are going to come into the hospital. But the hospital capacity issue, which is why we're supposedly having this kind of discussion, is the impact on the general population, not just the unvaccinated, that are going to cause major issues. If we want to get the public's attention, and it doesn't seem that telling them that the CDC thinks masking is going to decrease the prevalence, if we want to get their attention, as I said, it may be the discussion that was in the Denver Post on Sunday with the physician at, who remain unnamed, physician at Denver General. I still call it DG, John. And in that, he brought up the fact that not only could we be looking at rationing, but then there's the question of who do you ration? And what's the triage? And do the vaccinated get priority? These are questions that I think that will get the public's attention. It would get mine. As for the slide 14, I think it was, public health modeling report, it had a number of bullet points. The first was an estimate. It wasn't any factual thing. But on number 6, maybe with your influence, the people over there could stop using words like unequivocally shown to reduce transmission. Unequivocally is fine if you back that up with because of study A, B, C, D, and E. And the other studies that everybody quotes are not as relevant because of, but just to say unequivocally, doesn't cut it for the population that can view these things. And then after unequivocally at the end of it, they say that it's only limited evidence that the mask mandate reduces case hospitalization rate. And yet we're trying to reduce the strain on capacity. And they're telling us that there isn't a lot of evidence. It kind of argues against our proposals. When you go to slide 16, the three main interventions and their impacts, now we're getting to things. Number one, about the build population immunity, should have in there those that have recovered from COVID. Although that's sort of like playing Russian roulette. I'll get COVID and I'll see if I'm still alive in a month or two, or if I don't have long haul problems. The last one, the slow the spread through transmission control. This will reduce hospital demand in 2021. The supposition that masking equals less transmission equals less hospitalization. Yet, as slide number 3 showed, we went up even though we masked all last year. It would be nice to find out why we don't get the why we can't get the monoclonal antibodies, by the way, one of these times. I'm struck by the modeling using Facebook. Back in my youth, when I was in PhD, MD program, modeling based on surveys and polls would have been looked at rather askance. You know, if you can rely on polls, then Hillary Clinton was president. Oh wait, that didn't happen. Yeah, so I'm not sure about that kind of science. The rationale, that was slide 27, is avoiding the problems will take several action in several areas. And 4 are listed, although I think that there still are more. We've said in the past that vaccination is the most effective, yet we're meeting today about masking, which may be the least effective, or at least is down the list. When we list these possible interventions, I think they should be listed in most effective to least effective. As I said, I think our efforts should be on what's most effective. And I'll leave the comments to others now.
Dr. Douglas, did you want to respond?
Yeah, that was a brilliant review, Dr. Faywell. Thank you. Really appreciate the thoughtfulness with which you went through the slides. Let's see if I can I tried to, you know, I was a college debater. I would write down my points and see if I got all your points. You know, you began with a question of, gosh, if masks work so well, why did everything go through the roof in last winter? And the answer is masks are not perfect. Masks have always been considered to be part of, you know, a broad swath of efforts. Frankly, things didn't completely shut down when we locked down last spring. So nothing we have, including vaccines, by the way, and you and I are in total agreement that vaccines are our best strategy, are going to work perfectly. So, you know, the counterfactual, what would have happened if we hadn't, is always a dilemma. It's a dilemma in all of our public health interventions. And all I could say is that the circumstances in which masking has been looked at, including lots of studies last year looking at the policy impact of mask mandates, suggested in at least a short period of time where you don't have dramatic changes in overall transmission dynamics, masking does appear to not be perfect, but to help make a difference. Secondly, I just want to say again, because you mentioned vaccines several times, unequivocally, the best game in town. I think the question is, do we have a way to better implement the best game in town? We were doing really quite well on the vaccine rollout until about May 14th, when the CDC said, you don't need to wear a mask if you take a vaccine. Well, this is not cause effect, but we obviously began to see a slowdown in vaccine uptake. And all of the projections about when we were going to get to 70 or 80% just completely slowed down. Now, we could be having a discussion tonight about me asking the board to do what the city and county of Denver did, which was to issue a public health order mandating large swaths of the population to receive a vaccine. It's not clear to me that we actually have sufficient statutory authority to go there as a local public health department, even if I didn't know the vaccine mandates were going to be even more controversial. So we haven't gone down that pathway, even though the letter that the Metro director sent to the governor, that actually was, per your suggestion of ranking things in priority order, the top suggestion that we made. I don't disagree, by the way, with your notion that some element of natural immunity is important. That actually is included in the modeling efforts. You're also correct that we don't know which people who get a natural infection will actually get immunity. We don't know how long it lasts. I think we badly need to better understand that, because I think that needs to be part of a factor in the future. I'm not going to really defend the Facebook work that the Carnegie Mellon Delphi Institution has put together. You're right. Polling isn't perfect. Polling is a proxy. We liked what we did last year and ran out of gas to do it, which were parking lot-based observational studies. They tracked pretty well with what we were seeing in terms of cases, but we couldn't continue that. I will say, to me, one of the most striking pieces of evidence, though, is not just what's going on with mask wearing in places like Larimer County, but what actually very closely correlated with self-described mask wearing was seen in terms of hospitalization rates. So, Tom, I just want to say in conclusion, you've read things very carefully. I think your questions are really excellent ones. I think we are faced with a circumstance where we do not have certainty whether any of the measures are going to be sufficient to make a difference. What I hope we could agree upon is the need to ration care is sufficiently concerning that taking best shots, whether it's a vaccine shot, scaling of monoclonal antibodies, or enhancing the reduction of transmission prevention through face mask wearing, would be important for us to consider.
Okay, thanks, John. You know that I'm a mask wearer. I mean, well, I don't have it on right now because I'm the only one in the house, but having flown back from Boston last week and now coming down with symptoms, I go around the house with a mask, much less outside.
Thank you. We have people waiting for public comment, so I would ask that we reserve our questions and comments for this rich conversation to after the public comment period. So if we could now move into our 30-minute public comment period, members of the public who wished to make remarks were asked to register in advance. So we'll be now hearing from speakers in the order in which the individuals registered. Each speaker will have 2 minutes and should begin their comments by stating their county of residence. So Ronnie Brockman, our expert administrative assistant, will now moderate the public comment discussion. Ronnie.
Thank you, Kaya. All right, we will go ahead and move into our public comment section of the agenda. Lisa Bolstad, who is the administrative assistant here, is going to be the timekeeper. When you reach to the point where you have 10 seconds left, she will go ahead and let you know that. And then when you've run out of time, then we will go ahead and return you to the audience. First up, we have Frank Deluca. Frank, I'm going to go ahead and promote you to a panelist so that you can address the board. Once you are in, please state the county where you reside or work, whichever county you are representing.
Can you hear me now? I had to unmute.
Yes, I can hear you. Thank you so much.
County. Sorry. I appreciate, oh, can I go ahead or?
Yes, you can. Please do. I'm
Well,
sure that you're from
I
Arapahoe
don't
County.
want to sound, it just sounds to me, and I appreciate the comments the doctor had, just the questions. It just sounds to me like after watching this presentation, which is the first one I watched, that boy, are we engaged in a lot of mask theater here with words like unequivocally and things like that. And I do have these questions for Dr. Douglas. I mean, if we were masked all last year and masks worked so well, why didn't they stop the November, December, January surge? And furthermore, let's just look at this year. Look, what about, you mentioned these other states. What about Florida and Texas? Their cases came straight down as fast as they went up with no mandates. Go north in Wyoming. I look at their portal every day. Their hospitalizations have dropped 40% in the last few weeks and their cases are way down. They have no mandates. So there's obviously a lot of stuff that we just don't understand what's going on here. And to always go back and refer to masking, to me is just like hand waving. And I'm actually going to say, I'll probably use the rest of my time, this evidence of masking. A few weeks ago, Rachel Herlihy, I was watching the news conference, tried to say that masking was effective, had been shown to be effective, universal masking in schools. And you know what the evidence was? 250 cases per 100,000 per week in schools where universal masking was applied, and 300 cases per 100,000 per week in cases where it wasn't. Well, you know what? I actually looked up how to calculate efficacy, like vaccine efficacy, and I calculated that. The unmasked is 300, the masked is 250. Well, you take the difference of that and you get 50 and you divide by 300, and you know what the efficacy is? 16.67%. So Rachel Herlihy was making, I'm sorry?
You have 10 seconds left.
Okay, well, Rachel Herlihy was making the comment that these were effective and the efficacy is really 16.67%. I guess I'm out of time.
All right. Well, thank you, Mr. Deluca. We do appreciate your comments and thank you for taking the time to attend the meeting tonight and address the board.
Thank you.
All right. Next up, we have Melissa Roski. Ms. Roski, you can go ahead and unmute yourself and address the board.
This is Melissa Roski. I live in Adams County. I appreciate the questions about masking efficacy. There's a lot of things that if you cherry pick the data or if you're looking at poor data sources, and I know there have been a lot of questions as to the data out of Florida that can go one way or another. I have no question in my mind that if we had not had a mask ordinance in place last year, that the number of cases over the holiday trends, as Dr. Faywell was addressing, would have been much worse. And the fact that we do have vaccination now and we are headed on that trajectory without masking really scares me. I had to put my mom in the hospital 4 times last year, every time terrified she was going to catch COVID and that I might catch it. And even if I might recover okay, end up a long hauler. This has been very stressful. We aren't able to socialize very much because of these concerns. Data from the microcovid.org, microcovidproject.org clearly shows that they're taking data from all different circumstances and you can tweak it. And even having an indoor gathering with 25 people for 3 hours, there's a third of the risk when people who are of unknown status are vaccinated towards me when I'm vaccinated. Whether I'm wearing a mask or not, it dramatically increases it. Grocery shopping for an hour. Me wearing a mask, I can only increase my risk by 1/3. If other people of unknown status, everyone's wearing a mask, it decreases that risk down to 25%. To me, those numbers are worth something that really isn't that big of an imposition to people. Fine, if people want to say, oh, it's my body, fine, don't get vaccinated. But it's not fair to the rest of us who have been carrying this load for the last 1.5 years to risk us.
Thank you, Ms. Roski. I appreciate your comments. You take care. All right, next up we have, looks like Ellen Buckley. All right, Ms. Buckley, please state the county that you are representing, and then you're welcome to take 2 minutes to comment to the board.
I live in Adams County, and I strongly urge the board to support these proposals. I think we all wish the state would do something. The state should do something, but since they're kicking the can, Tri-County absolutely should. There's a lot of, as we know, it's been ridiculously politicized. Masks work. I never stopped wearing a mask, frankly, maybe for like a week. And then when the Delta variant kicked off, I put it right back on. I think you need to put aside the politics. You need to look at the science. You need to look at what works. Mask mandates work. And as has been said, no, they're not a panacea. They don't fix everything, but they do help. We need everything to help at this point. And I like also the vaccination program, because I certainly would much prefer to go to a restaurant. I'm not going to any restaurants and eating indoors, but I would go to one if it was vaccination required to go there. So I absolutely hope you enact these proposals. It's critically important to our health that people are as protected as we can be. Thank you.
Thank you, Ms. Buckley. We appreciate your comments tonight. All right, next up is Stacy McConnellag. Ms. Conalog, you're welcome to unmute your microphone, state the county that you're representing, and then provide 2 minutes of public comment to the board.
Okay, can you hear me?
Yes, we can, ma'am.
Yes, I'm a over 20-year resident of Arapahoe County, and I wanted to share with you some of my recent experiences as a community member regarding healthcare that really have frankly scared me. Within the past week, both my own primary care provider and also a friend who is a nurse told me independently that they each had lost a patient who were waiting for ICU beds, and neither patient had COVID. So these were separate deaths. Both providers felt like their patient would have survived if they had gotten an ICU bed. And a couple weeks ago, a friend of mine broke her arm. The first ER she went to told her she needed surgery and told her to go out and find a surgeon. Fortunately, she got into another ER and they took her in, took care of her, and did the surgery. But things are crazy, and it doesn't have to hit 100% for a lot of people to be suffering. A recent CDC report states that when hospital ICU beds reach 75% capacity, an estimated 12,000 additional deaths are associated within the next 2 weeks. And when they reach 100% capacity, 80,000 additional deaths are associated, unexpected deaths within 2 weeks. Colorado's been over 90% for the past month. So as all of you know on the board, one of the 10 essential functions of public health is to utilize legal and regulatory actions designed to protect the public's health. I strongly urge you to fulfill this function by passing this ordinance. Thank you very much.
Thank you, Ms. Conalog, for your comments this evening. All right, next up we have Deanna Ragsdale. And Ms. Ragsdale, I am not finding you when I search. So if you are here tonight, if you could raise your hand, that would be extremely helpful. If not, we will go ahead and move on to the next individual. All right, next up we have Greg McGow. I'm sorry, Greg, I know I'm probably butchering your name. Sir, you can go ahead and unmute your microphone, state the county that you are representing, and go ahead and provide public comment for 2 minutes.
My name is Greg McGough. I'm from Arapahoe County. Good afternoon, members of the board. This newest mask mandate is simply another feeble attempt to justify your previous actions and the very existence of the Tri-County Health Department. In March of 2020, you started with the infamous 15 days to flatten the curve. Well, here we are 20 months later, and you've locked down, masked, vaccinated, quarantined, and forced a remote and virtual society. Did you control the virus? No, of course not. And now you're trying to convince us that somehow you're going to magically fix everything in this fifth doomed attempt. Your efforts have sacrificed the economy, destroyed education, created loneliness, and cheated the entire population of the liberties and freedoms which are a part of being an American citizen. As a society, we are declaring a vote of no confidence in your abilities. You have proven you can no more control this virus than anyone can control an earthquake. Let's call your reign over this pandemic a failed experiment. It is time for you to simply get out of the way and let us get back to the business of life, liberty, and the pursuit of happiness. This latest Tri-County Health Department attempt is being met with public outrage and contempt. Future attempts will likely be met with insurrection. You have shown your inability to efficiently abate or control this virus. Over 99% of the people will recover from the physical effects of COVID-19. What is proving far more difficult is recovering from economic collapse, subjugation, deferred medical care, and mental despair. These are the entirely man-made side effects of the Tri-County Health Department's COVID cure. Additionally, I would like to point out that only allowing 30 minutes for public comment for a citizenry of 1.2 million people is absolutely ridiculous. You need to hear more people. Thank you.
Thank you, Mr. McGough. We appreciate your time and your comments tonight. Next up, we have Jacqueline Lauer. Ms. Lauer, you're welcome to unmute your microphone, state the county that you are representing, and then you have 2 minutes to address the board.
Can you hear me?
Yes, I can. Thank you.
Okay. Well, thank you. Thank you, one, for allowing me the opportunity to speak. I am like so many other residents in the district that are frustrated. I live in Arapahoe County, and I think the biggest issue here that, at least from, I'm a parent, that I see is that by putting in a new mandate at this point in time, one, looking at last year's data against this year's data, it's starting to we see the seasonal pattern emerging, and it feels like we are moving more into an endemic phase of this pandemic. Yes, there are things we can do, but I think that rather than issuing more public health orders and mandates, the communities would be better served with education. Educate, use your platform to promote social distancing, promote good hand washing, and to wear a mask. You know, one thing that one of the previous commenters noted was that wearing a mask, you know, that other people needed to wear a mask. Well, that's not exactly true. Tri-County could do a better job of saying, if you're a vulnerable person in this situation, a KN95 mask is much, much better for those individuals and will serve a greater good for them. People like myself who are young, who are active, who also got vaccinated, even though we had natural immunity, we're frustrated. We feel like you don't hear us, you don't see us. And you all, you know, it's always about, well, it's just a little thing. But the problem is that a lot of the data is inconclusive and we see it. We're not dumb. And there are so many calls for, you know, it started to undermine your ability for people to take you seriously, because the minute they do follow your guidance, you pivot. And when you do lift the orders, you reinstitute it. So at what point are we able to say enough is enough? Let's educate. Let's show the community be a good example to the community and move on. That's all. Thank you.
Thank you, Ms. Lauer. We appreciate your comments and your perspectives this evening. All right, next up, we have Stephen Lange. All right, Mr. Langer, you are welcome to unmute your microphone, state the county that you are representing, and then address the board for 2 minutes.
Thank you. I reside and own a business that I operate in Arapahoe County, both. I am a mask wearer in public. This order is about the potential scarcity of hospital beds, which is a very important resource to be sure. The fact is that, as Dr. Douglas pointed out, 82% of the hospitalized COVID patients in the CU health system as of this Saturday were unvaccinated individuals. Of the remaining 18%, more than half were patients who are immunocompromised. That leaves about 8% of hospital beds that are taken by otherwise healthy, vaccinated people. Logic dictates that any action on the part of government should target ways to encourage the unvaccinated to become vaccinated, or that they alone should suffer the inconveniences that a shortage of hospital resources creates, since those are the only folks who can really make active choices that will decrease hospitalizations over the long run. Given that COVID is here to stay, until it becomes simply too inconvenient to remain unvaccinated, cyclical fire drills like this one that we're considering today will continue to impact all aspects of life and business. Sure, absolutely go ahead with this order, but we can't keep trying only the same things, knowing that it doesn't work. It's not enough. We all know what the definition of insanity is, and here we are acting it out. The current proposal provides yet another temporary fix. It's a Band-Aid, has nothing to positively impact the goal that we should all have our eyes on, and that is increasing the percentage of vaccinated people. As a business owner and a resident of Arapahoe County, I implore you to keep your eyes on the prize. Everyone has the right to determine whether they become vaccinated or not.
10 seconds.
Those who choose not to be need to understand that their options of where they can go and what they can do will ultimately be determined by those choices. If that means they're last in line for a bed, so be it.
Thank you, Mr. Langler, for your comments this evening. Next up, we have Amy Kelly. Ms. Kelly, you are welcome to unmute your microphone, state the county that you are representing, and address the board for 2 minutes.
Hi, I'm from Arapahoe County. Excuse me. One thing that wasn't addressed when Dr. Douglas talked about hospitals is that hospitals' target capacity is typically 85%. That's their business model. And so they run at high capacity because they are a business and that's what their profit margins demand. So I think that's an important point of clarification to put out there, that high percentages are normal. I do not support a mask mandate. There are over 50 studies on NIH's websites that do not support masking healthy people against respiratory viruses. That includes coronavirus and its variants. The studies show a mask is an ineffective barrier to viral spread, even in institutional settings, in fact. Dr. Fauci admitted cloth and surgical masks that the average person wears are ineffective, leaky, and unnecessary for healthy people. A study of 10 million people in China showed that asymptomatic spread is infinitesimally rare, and thus masks for healthy people are unnecessary. While masks don't help, they do harm. There are 25 studies showing masks cause respiratory and immune system illnesses, as well as dermatological, gastrointestinal, and psychological injuries. There is no well-constructed study that persuasively suggests masks have convincing efficacy against COVID-19 that would justify accepting the harms that are associated with masks. Retrospective regional analysis in the US does not show that mask mandates had any effect on case rates, despite an overall 93% mask wearing compliance. Another mask mandate, if Tri-County Health chooses to implement one, will further erode the public's already waning trust in Tri-County Health and public health in general. Thank you.
Thank you, Ms. Kelly, for your comments and for taking the time to address the board this evening. Next up, we have Nikki Maxon. And Ms. Maxon, I am not finding your name in the attendee list. Could you please raise your hand if you are present this evening? And I don't see a hand. I think what we'll do in the meantime then is move on to the next panelist. Nikki, if you're in, we can always circle back to you. Next up, we have Neil Seer. And Mr. Seer, I am not finding you either. So if you are in the audience, please raise your hand and I will go ahead and circle back to you. We're going next to Susan Roberts. And that's interesting. I'm not finding Susan either, so I do apologize. Some of these folks don't seem to be present. Not finding Arthur Boucher. We are going to go ahead and move on to Tracy Dark. Ms. Dark, you are welcome to unmute, state the county that you are representing and address the board for 2 minutes. Are you there, Ms. Dark? Okay, we'll go ahead and we'll move on to Matt Dark. Mr. Dark, you are welcome to state the county that you're representing and address the board for 2 minutes.
Thank you. Business owner in Arapahoe County. Scary stuff heard so far today, and thank you for this time, though. Dr. Douglas, I do not envy the position you've put yourself in, and I don't feel terrible not having the pity on the ICU capacity. We all know that when vaccine mandates came through, you lost a tremendous amount of healthcare professionals, wiped them off. I know that because I know 7 personally, higher end folks. So you could all of a sudden have your mandate, your staffing back, but you got to drop the mandate. But this isn't a vaccine meeting. This is a masking meeting. And what this masking idea sort of promotes, based on the idea, if it saves one life, but we're talking about a 2-year-old. 2-year-olds all over the state, all over the country, making the assumption that the mask that they're wearing is going to be wearing perfectly, even if it had any evidence. The box that we have at our house, it says on the back, this does not prevent COVID-19. It says it right there, kind of like cigarettes say, you smoke these, you'll get cancer. Says it right there on the box. So we're making the assumption that those work. We're making the assumption that the 2-year-old will wear that full time properly for the rest of his life, or at least until he's 18 years old if he wants to stay in public schools. And if this is all in the name of protecting one grandma in Vermont somewhere, I'm sorry. I'm a compassionate guy. I'm a helpful guy. I'm not that nice of a guy. We are not willing to throw away our lives, our futures, our children's up. Do you know how hard it is to understand emotion of dialogue when you can't see somebody's face? You can't read the expressions of each word. You understand how hard that is when you're learning language, learning communications? And we want to tell children, figure it out elsewhere. Figure it out otherwise. And if you want to be maskless, stay home and have mom teach you algebra. What a sad set of events that could lead us to a different civilization. I heard earlier it's a virtual society, a Zoom society. Doctors, you took an oath not to do harm. I asked the board, ask him how many children are on a ventilator right now. How many? I guarantee you it's 1 or 0. Thank you.
Thank you, Mr. Dark, for your comments and your perspectives this evening. We appreciate your time, sir.
Thank you.
Next up, we have Caitlyn Quatromani. Ms. Quatromani, please unmute your mic, state the county that you are representing, and then you can address the board for 2 minutes. All right, we will go ahead and move on to the next person. Next up is Shauna Hogue. Ms. Hogue, please unmute your microphone, state the county that you are representing, and then you may address the board for 2 minutes.
Yes, my husband and I have a business in Arapahoe. We own a gym. And over the last 20 months of this pandemic, we have not had a single COVID case in our facility. We keep the gym clean. We encourage hand washing and have adequate ventilation systems to mitigate stagnant air and reduce the possibility of COVID transmission. And since mask mandates have been lifted in May again, we haven't had one single case of COVID in our facility. Our clients can now, that they don't have to wear a mask, train at full intensity. They get better workouts, they're healthier, and with healthy eating and workouts, they can boost their immune systems naturally and stay healthy against COVID. It's obvious that the spread of this disease is not from healthy individuals who are going to gyms, salons, nor restaurants. I think it's also worth mentioning that this hospital capacity cliff and staffing issue is directly affected by coercion of medical professionals being forced to take experimental gene therapy drugs without informed consent. Now, forcing individuals to wear a t-shirt on their faces 24/7 will not have as much of a benefit as encouraging everyone to eat well, exercise, get sunshine, and collectively lead healthier lifestyles. Thank you so much for your time.
Thank you, Ms. Herder. We thank you for your time and your comments as well. Next up, we have Corey Hamilton. And Mr. Hamilton, you're welcome to unmute your microphone, state the county that you are representing, and then address the board for 2 minutes. And it looks like you unmuted and then remuted. There you go.
Okay, sorry, I'm back. This is Corey Hamilton. I'm an Arapahoe County resident, female, not male, but no worries about that one. I would like to ask Dr. Douglas why he has the ability to remove his mask during public speeches that are online. He even apologizes saying, "We have masks in schools, but if you will please forgive me, I need to remove my mask." I do not support another mask mandate. Implementing another mask mandate is not only ineffective in terms of preventing the spread of viruses, but will negatively impact businesses that are likely still struggling for the last 2 years of public health mandates and restrictions. We have lost over 6 friends to suicide in the last 18 months. Let's start focusing on people's mental health and stop playing God. Thank you.
Thank you, Ms. Hamilton, for your comments, and my apologies for guessing that you were male. So sorry about that.
No worries.
Next up, we have Matt Jackson. Mr. Jackson, you are welcome to unmute your microphone, state the county that you are representing, and address the board for 2 minutes. Are you able to unmute your microphone, sir? All right, we will go ahead and move on to Katerina Marie. Miss Marie, you're welcome to unmute your microphone, state the county that you're representing, and then address our board for 2 minutes, please.
Hi, I'm from Adams County. I need to leave the room because I have this on 2 devices. Can you hear me?
We can, yes.
Okay, thank you. I don't have a prepared speech, but I do echo what Corey said. We all watched Dr. Douglas, and that was it was shameful. It was a joke. I want to bring up, with the hospital capacity issue, it is not our fault that there are less hospital workers. And in these rooms, when we listen to you guys talk and ignore the elephant in the room, people aren't going on sabbatical because they like working from home. People aren't going on vacation permanently because they want to reconsider the field that they went to school for, 8 years for. People are finally taking a stand and refusing to operate under tyranny. And that is why there are no nurses in the hospitals. That is why you are seeing people leave in droves. And now you're saying we have to adjust our sales because of that. Why don't you adjust your sales? Why don't you, when people show up to the hospital, say, do you mind if your nurse is not vaccinated? Because you know what? Nobody freaking cares. Nobody cares. You guys have these meetings where you ignore the most common sense stuff. And if you think we come to these meetings to listen to the data that Dr. Douglas carefully crafts to fit his agenda, you are mad. We sit and we do this research on our own. If you think that this is going to convince the unvaccinated to get vaccinated
10
by
seconds.
I promise you 100% of the people who refuse to get vaccinated will not be convinced by these ridiculous measures. We will.
Thank you, Ms. Marie. We appreciate your comments and your time this evening. And I'm sorry, I'm looking for the next person, but not having much success. Let's see. All right, next up we have Derek Easton. Mr. Easton, you are welcome to unmute your microphone and address the board for 2 minutes. And please state the county that you represent.
Can you hear me?
Yes, I can, sir.
Okay, great. Yeah, I want to echo what other people have said already on this call. It's an absolute joke that Dr. John Douglas is even on these calls for Tri-County Health. He's a joke. Nobody listens to him. Nobody's going to follow these mandates if you do decide to pass them. We are sick and tired of you. These mandates, if they worked, the virus would be over by now. We all went through last year. We all wore masks. We didn't even have the vaccine last year, right? We have more cases of the virus and more deaths this year with the vaccine than we did last year without it. The vaccine doesn't work. The masks don't work. I'm sorry. What you ought to be researching and talking about are some of these therapeutics that might actually do more benefit. Ivermectin, instead you can't even get a prescription for them. Your pharmacy won't fill them. It's asinine. It's embarrassing. It's ridiculous. I'm a high school basketball referee, and I'm gonna have to go wear a mask while running up and down a basketball court. The kids are gonna have to be wearing a mask while running up and down a basketball court. How is that healthy? Dr. John Douglas, if you truly are a doctor, be honest with the people. I'm in Adams County. This is ridiculous. We're sick and tired of you. You ought to resign in disgrace because that's what you are. You don't follow the science. You cherry pick
10
the
seconds.
science that you want to follow. And your degree ought to be revoked. You're an embarrassment. And any of you on this.
Thank you, Mr. Easton. Your 2 minutes is up. Thank you for your comments, sir, and your time this evening. Next up, we have Shume Navarro. Ms. Navarro, you are welcome to unmute your microphone, state the county that you are representing, and then address the board for 2 minutes.
Yes, my name is Shemaine Navarro, Arapahoe County. It's obvious what you are planning on doing, and I'm here to tell you that this order is completely disenfranchises those of us with medical exemptions or those of us who have suffered trauma and cannot medically wear a mask. You try going into these places and explaining to them that you can't medically wear them and see how they treat you. I want you to know that the mask mandate completely ruined my small business. I find it interesting that your order mentions that vaccinations remain the most effective mitigation. Yet the whole reason why we are having this meeting, per your summary, is because hospitals are experiencing an increase in admission and staffing shortages. Does the fact that you have mandated vaccines for medical personnel not ding any bell for you? People are leaving in droves, and you have the nerve to say things like this is the pandemic of the unvaccinated. No, this is the pandemic of tyrants. Hospital staff is low, so you enact a medical mandate, which resulted in staff leaving. This is concerning to you, so you mandate masks. That's funny. What is so funny and representative is how the corporate medical industry addresses problems. You don't go to the source, you treat the symptom. And in this space, your approach is actually punitive, Dr. Douglas. You guys haven't had an in-person meeting since the start of this. And it's pretty easy to make such mandates for people when you literally do not wear a mask for 8 hours a day at your own job. John Douglas, as mentioned before, couldn't even handle it for 30 seconds for his public comment, yet you are forcing this on our county. Mind you, 70% of the county is vaccinated. So how is that the vaccination remains the most effective mitigation when our numbers do not prove its efficacy? How? I just want to continue to say that we will not comply. There needs to be a choice. You guys have cherry-picked your data, like everybody has said, and we are over it. There is no reason to be mandating.
10 seconds.
And we are completely done. Stop this power grab and let people make what choices they want to make for their own bodies. Thank you.
Thank you, Ms. Navarro, for your comments tonight. All right, and I think we'll hear from 1 or 2 more. That should put us at 30 minutes. And I'm sorry, I'm just searching down the list, trying to find names. All right, next up, we have Hillary Mast. Ms. Mast, you are welcome to unmute your microphone, state the county that you are representing, and address the board for 2 minutes.
Hi, thank you. I appreciate you giving the public time to voice our concerns and our opinions. And I have to say, I really empathize with the woman at the beginning of this public comment session who was concerned with the health of her mother. I understand what it is to be a caretaker I'm the mother of 4 small children. And I have to say, the masking is absolutely ridiculous for young children. I don't know if any of you still have young children, but when you put something near a child's mouth, it automatically goes inside of it. There's nothing that you can say to a 2-year-old. And trust me, I've tried. My kids are 7, 5, 3, and 3 months old. We have been very obedient, diligent maskers at the beginning. And then guess what? When mommy and daddy got vaccinated, we said, okay, kids, we can go into public, show our faces. You know, you don't have to deal with the drool rash. My middle child, who doesn't have a medical diagnosis, but definitely as her mother, I know she has issues wearing a mask over her face. She can't do it. And so what this is going to do to people with young families, it's going to drive us to go to Douglas County to do our shopping, to do our living our life in public. If we can't take our children out with their faces uncovered and be able to interact with the public after, mind you, a year and a half of having been homeschooled against our will, then we're just not going to do business in Arapahoe and Adams counties. And it's really distressing to me that you would continue to push this after they've already been shown to be ineffective in our public schools. If they were effective, we wouldn't have kids home in quarantine. Thank you.
Thank you, Ms. Mast. We appreciate your comments tonight. All right, Dr. Gallagher, I am going to go ahead, I think, and take look for one more individual. And at that point, I will turn it over to you to determine whether we want to continue to hear public comment or if you want to move into the discussion among the board members.
Renee, if there's one more person that you can find, that's fine.
Okay, all right. I'm just going down the list in the order people have signed up, and if they're here, then I have them talk, and if I can't find them in the list, then I move on. All right, next up we have Dale Knepp, and I do apologize, sir, if I am not pronouncing your name correctly. You are welcome to unmute yourself, state the county that you represent, and then address the board for 2 minutes, sir.
Hi, thanks, Renee. Thanks for picking me. I appreciate it. Dale Knepp, Arapahoe County. This is directed to Dr. Douglas. The models have never been right. Presenting Facebook data today is beyond offensive. There's never been a correlation between masks and COVID outcomes. You say there's data source. We have begged and pleaded, give us your data, show it. I have sent you dozens of studies, dozens of independent data sources that substantiate there is no correlation to masking. Please show us your data if you have it. I'd also like to share hospital capacity. This is what we've heard from the beginning. 2 weeks to flatten the curve, hospital capacity can't handle it, and millions of deaths. Neither have ever happened. If you look on the Tri-County Health Department website today, hospital capacity of people with COVID is taking 13% of the beds. There has never been an issue, not once. Look at the data on your website. Has hospital beds ever been more than 20% of COVID patients in the Tri-County area? 80% of people 12 and over have the vaccine based on your own data. And this is a disease of the old and comorbid. 99% of the people who get this will survive. So many lies. I know business people and politicians who sent you emails today saying they reject this. You have threatened criminal liability on teachers if they don't enforce this. You have flat out lied on this call. We will not comply anymore with this tyranny. And you can bet your ass vaccine mandates will be
10 seconds.
controversial. Please don't pass this order.
Thank you, Mr. Knipp, for your comments tonight. We appreciate your time, sir. All right, Dr. Gallagher, I will turn it back over to you.
Great, thank you. Before we move into the board member discussion and vote on a mask mandate, I just wanted to see if there are any further questions about Dr. Douglas's presentation or any remarks that Dr. Douglas would like to make. I'm trying to separate out the questions that relate to the update, the COVID update, and the rationale from the discussion about the actual vote on our mandate. According to Robert's Rules of Order, we'll need to take a vote on whether there is a proposal on the floor before we have a discussion about the mandate. So I'm trying to separate out these two areas of conversation. But I have a question for you, Dr. Douglas. I know that Governor Polis has put an emphasis on monoclonal antibody therapy and trying to make it available, and yet I heard you say that the supply is inadequate. Do you have some sense of when there is going to be enough of this effective strategy? Because it sounds like that actually, when you combine it with the vaccines and the masks and all the other strategies, that it really could have a potentially strong impact.
You know, I don't have a clear prognosis about the supply. Back in the summer, we were begging people to take it. We had tons of monoclonal antibody. As things began to get worse, the supply got more challenging. I don't really understand whether it was a manufacturing problem, or I suspect more likely because there were a number of states around the country where there were, frankly, lower vaccination rates than here, where lots of folks were seeking monoclonal antibody treatment, and states like Colorado had a shorter supply. By the end of September and early October, I was told the supply was not bad. We've never, as a local public health agency, been provided, like we have for vaccines, any information about the state's going to get this much this week and this is how it's being used. So I don't have a good week-to-week summary as to how much is being used, except that it's far from the targeted 50%. And I also don't have a good week-to-week prognosis about how much we're going to get, except that we've had, again, our personal departmental experience telling us it's sporadic. And what I've heard from the School of Public Health has been working with the State Health Department.
Thank you. Were there any other follow-up questions on Dr. Douglas's presentation before we move into our action item? Yes, Julie.
Great, thank you. Just want to make sure you saw me. Quick question. So, John, we heard a lot from the commenters about, losing staff due to the vaccine mandate for healthcare workers, which a vaccine for healthcare workers mandate, that the vaccine mandate for healthcare workers is not new. I've worked in healthcare for a really long time now, and we had a flu vaccine put in place mandate quite a while ago. So do we have an idea of how many actual healthcare workers have left the metro area hospitals because of COVID? I work in healthcare. I have my own perspective of why people are leaving, and a lot of that is burned out. People are overstressed and tired of honestly being overstressed, but that seems to be a recurring issue that a lot of the speakers were talking about. Do you have any information around this?
Julie, it's a really good question. The hospitals don't really provide that sort of information in a uniform way. What they do provide are projections of staff shortage for the coming week. And I don't know whether Michelle Eskenazi is on the line. I think she lost power at her house and she may have not be able to be plugged in here. 2 weeks ago, I think the projection was 38% in the North Central region of hospitals were projecting staff shortages. That's a qualitative measure. It's not like we're down 10 or we're down 2 or, whatever. That's the best information I have. I think it's, you've asked me this question before, honestly, and it's a parameter that I don't think my answer is better now. It's a parameter we've been badly wanting. We hear the same thing qualitatively from systems everywhere, but I've never really seen it adequately quantitated, except for that next week's projection thing.
Yeah, and so thank you again for trying to answer this question. I know it's hard to get this information. From my perspective, burnout is the driving factor for healthcare workers leaving the industry. I mean, now that's my personal perspective. I just wanted to see if you had anything to add to that based off of the conversations that we've been having.
So, Dr. Douglas, I have another question. Several of the speakers talked about the importance of really focusing on those who are unvaccinated. I know your presentation really focused on masks, the proposal at hand, which is indoor mask mandates. But that's not to say that Tri-County is not doing as much as possible to encourage vaccination. Do you just give me a snapshot of where things stand with your vaccination efforts and the uptake in different areas of our region?
Yeah, this has been probably our number one focus, really, honestly, since last January, when we first began to have the availability of vaccinating folks. We had a large number of our staff dedicated to this effort. Originally, it was very limited by supply. We were scrambling as hard as we could to help folks having trouble signing up for vaccines, figure out how to do that. We spent a lot of work trying to work with partners as well as our own staff to do outreach to homebound people who couldn't get the vaccine. Fast forward to March and April, vaccine supply got a whole lot better. We had a whole lot more partners, particularly our pharmacy partners that were offering the vaccine. However, we began to see a continuation of trends emerging of differential vaccine uptake among different communities. We saw it by geography and census tract. We saw it by race, ethnicity. We particularly had low vaccination rates in our Hispanic populations. We spent a lot of effort trying to scale up our involvement with organizations that frankly might be more trusted by those communities to understand what the issues were with vaccination. Some of it was lack of information. Some of it was misinformation. Some of it was frankly, people's lives were complicated and getting to places to get a vaccine was challenging. So we worked with the state on a number of different approaches to more effectively bring vaccines to people. We took efforts at mobile home parks or low-income housing, and we have seen some of those gaps close. More recently, we have been, and I appreciate one of the speakers talking about public health education. I'm sure there are things that we could do better in the space of trying to help people understand why they should get vaccinated. More recently, we've been focusing in particular on folks that need boosters, and particularly focused on folks that were older who need boosters. One of our last speakers pointed out that it was folks that were older and with comorbidities who were at greatest risk. That's actually very, very correct. So we've been reaching those groups. And then finally, we've been trying to provide information to parents who've got to be, I think really quite thoughtful about what they want to do with their 5 to 11-year-old kids in terms of getting them vaccinated. But we're working very proactively both to get information out as well as to work with our schools, many of whom have been very excited about creating school-based vaccination opportunities. So it's a multi-pronged strategy, but most of our speakers, not everybody, but most of our speakers acknowledge the importance of vaccination. We completely agree with that. The mask part of the equation is a kind of a bridge to get us through a tight spot in terms of our hospitalization to get us to a point where more folks are vaccinated.
Great. Do any other board members have questions? In the meantime, Dr. Douglas, were there any other comments you'd like to make before we move to our action item?
Well, I guess I'd like to acknowledge the obvious. Maybe I said this at the beginning, that we did not undertake this because we enjoy exercising tyranny and power. We didn't exercise it because we were looking to win a popularity contest in the community. We undertook this because our reading of the situation was that there were substantial downsides that were going to accrue if we breached hospital capacity and had to ration care. And while we do not think that masks are the be-all, end-all, one-size-fits-all, this is really multifactorial. We do think it is one of, frankly, the two things with accelerated treatment, if we can get sufficient supply, that could tide us over this tight spot that's coming as we experience more seasonal transmission and as we get better vaccination rates. So I just want all the folks listening to tonight's meeting, by the way, we appreciate the interest of the community in this issue. And I want the board to know that we are not asking the community to listen to this and not asking the board to consider this in any sort of lighthearted way, or because, again, we enjoy being tyrannical. We think this is really something that is needed in our communities. It would have been better. We think if this was done more broadly, that was not a choice the state made. And we think it's best for our region if we can work with our peer health departments in Jefferson, Denver, and Boulder to try to create as common approach to bridging, excuse me, bridging the current situation with a greater uptake in masking until we can get through the hospital crunch.
Great. Thank you. So let's move on to the action item. According to Robert's Rules of Order, we need to actually move to have the motion approved and seconded, and then we can have discussion and a vote. So Renee, could you pull up the draft motion? Just to refresh the board members, the motion is to authorize the director to respond to the crisis in hospital capacity by instituting an indoor mask mandate. It would apply to all individuals 2 years and older. It would be effective, become effective on Wednesday. It would remain in effect through January 2nd or thereafter until staffed ICU capacity reaches 10%. Sorry, that should be January 2nd, 2022. So we're not, we're not in a time warp here. And then importantly, it would allow owners, operators, and managers of public indoor spaces who have implemented vaccination requirements for all individuals entering their public indoor space to request an exemption. And I think Dr. Douglas explained that. And for those who are interested in that, I'm sure more information will be available on the Tri-County website after our meeting. Again, we need to have a motion to approve this, second it, and then we can have discussion before we have a vote. So Jan, did you?
I just have a question. I have some observations to make. They're not necessarily discussion on the exact order. Where would that fit best?
Well, if it is part of the conversation we're having before, we can certainly entertain your questions or comments before we move to have a motion on our indoor mask mandate. But if it's related to the motion, it needs to happen after we have a motion and a second.
It's just basic observations about some of the things we talked about tonight before we discuss the actual, and I'm not sure.
Go ahead and share.
Where it fits. But a couple of things that I've thought about through all of this is that I know that, first of all, I'd like to thank everyone for their comments. I know that people have really strong beliefs, and I understand that. I, in my own mind, am struggling with, if you have really strong beliefs, I think those beliefs certainly should be recognized, but they should also be something that takes into account if you come up against other situations. I'm wondering how people believe about things. And here's my perfect example. The federal government has mandated masks for airports and airplanes. We are asking for a mandate for a mask in indoor spaces, and we aren't in indoor spaces that long. I mean, yes, you might go to the mall for a couple hours, you go to the restaurant, but you can take it off to eat. I'm just wondering, in my mind, I'm thinking, you go to the airport, you have your mask on for 2 hours probably to get on the plane. You're on the plane for 4 to 6 hours. Then you get off and you wait for your luggage, if you're lucky, in an hour. And then you have to do it all over when you come back. The federal government has mandated on trains and I was going to say boats, planes, and public transportation in general. We're not hearing anybody getting really upset about that. And I think in context to that, or in the context is that we're asking people for half an hour, maybe at the grocery store, maybe an hour if you're there longer, to put on a mask. And when you go into that store, you're seeing, I'm not seeing a lot of mask wearing since it became not popular to wear masks. I wear them. I've never taken them off, and I'm vaccinated. But I also see these employees that are wearing them for 8 hours a day. They are wearing them, and they have to wear them, I guess. Otherwise, they wouldn't be, or they maybe make good choices. But we are going in there, and we're not wearing masks, and we're not respecting them. We're not respecting. If we're not wearing masks, I'm sorry, we're not respecting them and their ability to be there and keep that business open and appreciate what they're doing. Because I don't think anybody likes wearing a mask. I work professionally, I wear masks, and we had to, and we never thought about it. I don't like wearing them now, but I do. So I'm looking at, we're not closing bars. We're not closing restaurants. We're not closing schools. We're trying to keep them open on this continuous path. We're hitting blips that we're trying to do as a public health entity, trying to figure out a way to make this work. And this is something that you may or may not agree with, that public health has figured out that this might be and hopefully is something that will work. And I'd like to point out just what Dr. Douglas said. This is not Dr. Douglas. This is not Tri-County Health Department. These are all health departments considering the same thing. We are not trying to make rules by ourselves. Believe me, and I can attest for all of my fellow health board members, we have spent hours on this and we have agonized over it. And we know people agree and disagree. And it's hard. It's been very wearing on us as well as the people in the hospital. Julie hit it right on the head. A lot of that staff, they're burned out. For a year and a half, they have been working hard, trying, I was in the hospital the other day and I actually thanked one of the nurses and I thought she would just kind of say, well, yeah, here's another person trying to be really, nice to me. You can't imagine the genuine appreciation she had that someone took the time to thank them because they are burned out and we need to recognize this. This is part of helping the hospital staff stay in their jobs, still feel that urge to help people, that's what their calling was, and not seek out another profession. So these are my thoughts. And I just say at Thanksgiving, I'm thankful that I can still go to a restaurant, a shop, and be with family this year because last year I didn't. Thanks, Kaya.
Thanks, Jan. Did anybody else have some broader observations they'd like to make before we move into our action item on the agenda? Okay. Not seeing anybody who had their hand raised. So we have a motion on the floor. I would ask, is there someone who would like to move to authorize and direct the director of the Tri-County Health Department to address the growing crisis in capacity by the points that are up on our screen? Julie Mulligan?
I'd like to make that motion, please.
Okay, great, thank you. And I will second this motion and then I will open it up for discussion. Any board members, when we will take a roll call vote, which will enable you to make comments for or against your vote as we move forward. Dr. Faywell.
Thank you. Well, motion. I'm a bit conflicted. I've been on the board for more than 18 years and been concerned with the public health of citizens of 3 counties, but with Douglas gone and with Adams moving on next year, I find my concerns are focused now on the Arapahoe citizenry. And contrary to what some of the writers who send us emails think, we do read your opinions. Initially, when this all started, our board policies were to avoid the very situation that we're in now, and that's hospital capacity. Now we're discussing mandatory masking as an answer. One might question the message we're sending to the public, having gone through this a number of iterations. And we brought up the subject of rationing healthcare and differentially treating patients is not a part of standard medical service and training. Now, when I was in the military, it was, but that's different. No one wants to do that. But if we continue on this trajectory, that's exactly what might happen. And as I said earlier, maybe that's what we have to put out there as a message. Maybe it becomes the clarion call to the public that this is serious and we have to do something. Complexity, though, of hospital capacity goes far beyond mandating a specific behavior, nor will the capacity issue be solved by mandating one specific behavior. Yes, it may help slightly, may help a lot, although in the past it hasn't. It's difficult to predict. And I don't want to take a survey or a Facebook survey to predict where we'll be. We have assumed in the past that if we look at a state or a county or a region and say, well, this is state A, and we'll compare it to state B or county B or region B, and we'll see what the best way forward is. There are so many variables from state to state and from county to county, region to region, vaccination rates, cultural differences, geographical issues, that it calls that assumption that we can compare A to B into question. What's not in question is the number of beds that we don't have, the number of deaths that we've seen, number of people with long haul complications, and the fact that the Front Range hospitals are referral centers for a wide area. And so we're asking our citizens to do something when we have a hospital issue that hasn't really been addressed by the state. We're bringing in FEMA to help out. We have a number of retired healthcare workers who, given the right circumstances, could be tapped for volunteer service, not frontline, not put them in ICU, but free up people who could be. We haven't done that yet. We want to put everybody in a mask. I don't mind wearing a mask. I think a mask is effective. But at this time of year, we are going into the holidays, and we want struggling entities, restaurants, small business owners to do this. I'm not sure that this is going to be the best, well-received or enforceable type of mandate. Taking all that information into account, I feel passing this motion will not achieve the desired effect, which is what we're doing here tonight, to reduce capacity, but it will have negative effects on many fronts. Thank you.
Thank you, Dr. Faywell. Are there any other board members that like to make a comment? As I said, we'll take a roll call vote and each person will have a chance to speak to justify their vote for or against. Okay, not seeing any hands raised. We have a motion on the floor that has been seconded. We have had discussion. So at this point, I'd like to move forward with the voting. And we will start with the Adams County Board of Health members. Julie Mullica, could you tell us how you would like to vote?
Yes.
Okay, great, thank you. Rosanna Reyes.
Yes, in favor of the motion.
Great, thank you. Julie Shills.
Yes, in favor.
Great, thank you. Dr. Faywell.
No.
Thank you. Jan Brainerd. You're muted, Jan.
Sorry. With my background, my experience, and my belief in the effectiveness of public health, I support this temporary order to protect all of our own health in this difficult time. Yes.
Thank you. And I'm going to vote yes too, as well. I just like to say that we're all eager for the COVID pandemic to be over. Unfortunately, the COVID virus is still an enemy that we need to defeat. And I've been concerned that our hospitals are overflowing, but I also would like to point out that there already is some rationing of care. I have a terminally ill neighbor who waited 5 hours for an ambulance that never arrived. Finally, a friend drove her to the hospital. You know, people are already suffering in terms of being able to get access to the hospital care that they need for a variety of reasons, beyond simply the fact that a number of unvaccinated patients are also filling up the beds. We recognize that our tools are not perfect. Masks do not provide perfect protection, but from my opinion, we need to use all of the protection tools that we have. I am voting for this order because it has a time limit. I'm voting for this order because it allows for some exemptions to businesses. And I do hope that by placing this order, mandating this public health order for indoor mask mandates, that more people will begin to take seriously the crisis in which we find ourselves. Are there any other statements that the Board of Health members would like to make at this point? Not seeing any. Thank you. The motion has passed, so that will empower the Tri-County team to put together the details about putting this mandate in place effective Wednesday. Thank you all for your attendance at this meeting. Thank you for all the members of the public that shared their opinion. I wish everybody a happy Thanksgiving. And do I have a motion to adjourn?
So moved.
A second?
Second.
All in favor, say aye.
Aye.
Aye. Anybody
Aye.
opposed? Thank you. Rosanna, did you want to say something?
No, it was just my vote.
Oh, okay, great. Well, thank you all for your attendance and for this very careful consideration of the mask mandate. The meeting is adjourned.
Thank you.
Thank you.
Good night.
Good
Happy
night.
Thanksgiving to all.
Happy Thanksgiving to all.
Happy Thanksgiving, Dr. Douglas.
Thank you very much, everybody.
Take care. Bad.